Oh, okay, so hi, I'm Dr. Vizniak with the amazing
Carolyn Mukai
and the amazing
Chelsea Leander.
And today we're going to take you through a joint mobilization / Manip practical exam. So this would be OSCE exams where you're going to different stations. This could be an exit exam. This could also be an oral practical exam where you could use this basic skill set to progress through and show that you have the abilities to treat patients in real life. So without further ado, I will be the proctor. This will be our super examiner, and this will be our patient as we go through this. So starting with our first question, as I awkwardly step off the camera, I'm going to edit that out later. Okay, starting off with our first question, making sure this camera's rolling. I was wondering if you could go ahead and give us a list of relative contraindications to joint mobilizations.
Okay, so anticoagulant therapy, any prior history of bad manipulations or chiropractic adjustments, and ankylosing spondylitis, disc herniations, and hypermobility or ligament laxity.
All right, so now your patient has come in and they are here for an assessment and treatment. Can you go ahead and please assess their SI joints and correct what you find? They're going to have a mid-thoracic extension restriction that we'd like you to correct in a supine position, and a cervical spine. Assess and correct what you find.
Sure. Okay, so Carolyn, I will have you face down first. Checking for the SI. Is it okay if we do a hands-on assessment?
Yes.
Okay, let me know if there's any pain or discomfort, and don't do anything that you think will cause you further injury. Okay, so just lifting up the shirt here, we're going to take a look at the PSISs. And here it's looking like a right PI. And then we'll just do a bit of joint play too to see if that's locked out. And it is more locked on her right, so that's looking like a right PI. And go ahead and fix it.
Okay.
Okay. So we'll get you on your left side facing me. Gotta learn how to work this table. I got it. All right, so I'm gonna bend this leg, bring you towards me. Good. Okay, so with my hand over the PSIS and then slightly medial, my tissue pull is going to be M to L, P to A. So I'll have you take a deep breath in and out. Okay, and then we can reassess and make sure that it went by doing the sit test. So I'll have you sit up. That was hard to tell. Do that one more time. Okay, and sit up. So it's a little bit better. And thoracic. So get you on your stomach.
So we're going to say she has, go ahead and assess. If you find any restrictions, please let us know, and let me know what they are.
Okay, so on your stomach again. So around T9, T10, we have a extension restriction.
Okay, can you please correct that in a supine position?
Yeah, so get you on your back. Oh. Okay, and then yes, I'd like you to give yourself a big hug and lift this knee up for me. I'll have you roll over towards me.
And so again, verbalizing tissue pulls, all that stuff for us as we do.
Okay. So the tissue pull is going to be S to I and P to A. Okay, so have a deep breath in and out. Okay, and then cervical.
Cervical spine, assess and correct what you find.
Okay, so you can just relax. And I'm going to lower this just slightly. You're good. Well, I found a lymph node on the left, but that is non-bone related. Your neck is pretty good right here. Okay, so we have a C2, C3. left rotation restriction.
Okay. And so Carolyn's okay if she does that?
Yep.
Okay.
Okay, so my tissue pull is L to M, M to L, L to M, and a slight P to A.
Okay.
Okay, do you need a warning?
Nope.
Okay. There we go. How'd that feel? Okay.
Okay. All right, so we'll go ahead and get some feedback with that then really quick.
Okay, we'll get you to sit up.
Okay, so that was an excellent job right there. So first of all, just so we're clear on this, the requirements for contraindications are so important, they are literally a pass-fail. If you don't know them, you will be rewriting this exam. And I have seen and tutored students who have failed their exams and done excellent in everything and didn't know the contraindications to their adjusting and mobilizations. So please make sure you know that. Just know it cold and life will be a better place for you. All right, going through the Manips here, fantastic job. So we're looking for a flow overall, and she had a decent flow, as much as we can do in the artificial part of the examination process. But we had a right PI to begin with, so good instructions were given at the very start, good tissue pulls were told to us so we could understand what she was doing as well as see it. One of the things that I might make a comment on, and this is really a finesse point, minimal marks off for it, was just a little bit loose on the drop. Like it was not quite as tight. Like your cervical adjustment, that was tight. Like that was dialed in, really good thrust on it right there. Okay, then the thoracic one, it was a really good job as well. Good tissue pull, good breath in, breath out all the way through. But you could see, and if you go to the video replay, you'll see it, her back leg was totally straight. So I'm going to do a variation of that, and it's only a minor thing for that one. Let me just go ahead right here. Yeah. The cervical was excellent. Like you could see how her body moved, really, really tight, really controlled thrust. And especially for cervical adjusting, that's what you want to see. Just nice, tight, controlled body movements to make sure the patient is ultimately safe.
Okay.
Questions, comments?
No, I think that's it.
Okay.
Yeah.
One of my favorite things to do always is to demo, because I like to role play as though I'm the student here. So we're going to go and role play what I saw so we can see it right here. So we can go ahead and lay down on the side here for us, Carol.
On the side?
Yeah, let's do the side. Yeah, we'll do the side right here. It was your thoracic one. Yes, we'll do the thoracic one. So give you something laying on your back, sorry. Yep. And sorry, I'll lay on your back.
Oh.
Yeah. Okay, come on, chest stiffen, it's difficult. So what can we see here? She's tall. She's got this good height advantage that she can actually use, and maybe we'll have you stand just like right there. And patient rolls over, bends this knee, rolls over. Everything's great, but with this back leg straight, what winds up happening? You lose the strength to actually reach. So you can feel the body weight there, versus this comes forward and you can drop on the person, right? And then the same thing for the SI adjustment. We're going to have you flip over this way for us. So for the SI setup, what do we see there? Good setup, good mechanics all the way through. Have you come right to the edge, hand into elbow, good marking the PSIS, big breath in from the patient if you want, breathing out. She breathes out, but the drop when it came in was a little bit like not, you can feel force into it, but not as tight as your other drops were.
Yeah.
So really finesse points, that was more than enough to pass the exam, but we want to make you the best possible version of you we can, so these are...
So how would you fix that?
How I would fix that is I would wait a little bit more before I actually dropped. And this is what most students do when they're learning, is they try and rush it a little bit too much. So what I would do here is I would say, okay, where is her end range? This kind of a setup right there is her end range. So that's where I would stop and I'd say, okay, give me a big breath in, all the way out, tight, 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 load, 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 and then a little drop at the end of it.
Okay.
90% setup,
10%.
10% thrust.
Yeah.
Okay, all right. Okay, so hopefully you found this useful and beneficial for your exam, and it will make you a better version of you. My kids are screaming in the background right now, so I gotta go get them.
Snack time.
Right, yeah. Okay.
Yeah.
All right, so let's go ahead through the rest of this exam. This patient is presenting in your office. Please assess and correct what you find as we go through, and then we'll give you an actual one adjustment that we'd like you to perform for one of those regions. So as you're assessing, give us the listings that you want to correct.
Okay.
Make sure it's okay with your patient, and then we'll progress through from there.
Okay, sounds good. So then, I don't know how to use...
So you just press this down.
Okay. So if you can just lie on your stomach. Okay, so this is all going to be hands-on. If there's any pain or discomfort, please let me know right away. And don't let me do anything that you think is going to cause you injury, okay? All right, so first we'll just start walking down the spine, just seeing how the spinal segments move. Oh, little incidental cavitations there. That's through the thoracic spine. There's some extension restrictions that already partially cavitated.
What spinal level was that?
So this is about T10. So just coming down to the junction of the thoracic spine and the lumbar spine. So here I would want to test rotation. So for this, I'm just going to have Chelsea lift her hip up a little bit and then relax back down into my hand. So this, we're kind of assessing the left rotation in the lumbar spine. So just trying to feel each of the segments. Then I'd come around to the other side. And relax back down in my hand. So a little less movement on this side, which would indicate a right rotation.
At what level?
I usually do more specific level testing once I have her in the position and just do a little challenge. And then for the SI joint, so we're finding the ASIS, and then, or the iliac crest, sorry, and then finding the PSIS, looking at the height. They look level to me, so we'll just go ahead and apply some force. Any pain with that?
No.
How about in there?
Because we're stuck.
Stuck on the side, so that would be a right or left SI potentially. Then we're just looking if there's any, this is usually easier to see without pants, but covering the area, just looking at the popliteal crease, just seeing if those, and they look actually pretty lined. Okay, so Chelsea, I'll go have you flip onto your back then. Oops. Like this. Okay.
We'll get that out.
Sorry. Okay. Actually, I'll start off with a thoracic adjustment. Let's go ahead and do that. Give yourself a nice big hug. And then if you can just scoot down the table a little bit. Good.
Really break the table.
All right. And then if you can roll towards me. Okay, so that she had thoracic extension restrictions pretty much all throughout. We got some to cavitate up higher while we were setting up. So we'll start off around T4. So the tissue pull for this one is a fist contact with the fingers and the thumb with the spinous process in the middle. And the tissue pull is going to be S to I, and then the line of drive will be anterior to posterior. Okay, so go ahead and take a breath in. Breathe all the way out. And we'll try that again, just one segment lower. Okay, breath in. And breathe all the way out. Okay, all right. And then it was the right-sided SI. No, wait, it was your left-sided SI. So let's have you lay on this side facing me. Okay. And Chelsea is very flexible through her lumbar spine. So for this one, normally you would have the hips stacked, but I'm going to have her bring the shoulder out just a little bit. And then just scoot one more time. Good. Okay. Okay. Breath in and out. And then I'm actually going to try that from the other side, doing a sacral adjustment, just to see. So the contact, I forgot to say the contact for the other one. So if it was a PI, the contact's going to be on the PSIS and the hypothenar eminence, and the tissue pull is going to be M to L and I to S. But for the sacral adjustment, the contact's palmar, and it's going to be superior to inferior tissue pull, and then both of them are P to A. Okay, breath in and out. Okay. And then checking down here. And go ahead and sit up. Very good. Okay. And you can lie back down. And then it was right-sided lumbar rotation restriction. So we'll have you lie on this side facing that way. Okay. Come back this way. One more time. And again, she's very flexible through her lumbar spine, so for this one we'll have her come out even more like that, and we'll probably lay her flat just like this. So the contact for this one, I'm going to do a mammillary push. Starting on the downside of the spinous processes, using the hypothenar contact, and coming to the high side of the SPs, just over where the mammillary process would be. Okay, so go ahead and take a breath in and out. Okay. And then we'll assess the cervical last. Okay. Okay, so a little bit around C2, C3. We'll just turn you this way and then come back the other way. One more time. Okay, is it okay if I adjust as I find it?
Sure.
Okay.
Great.
And then just seeing the other way. It feels pretty good on that side. Okay.
Nice.
Okay. All right, that concludes this exam. Really well done. We'll give some feedback and all that kind of stuff. So that's another way that you can actually do this, is flow through it. It's probably better if it was a student who was just first learning. That's when you would actually go through and maybe prompt a little bit more, but the flow is really what you want to see a little bit more of. So a couple of key things right here. Number one is her flow is excellent, right? You can see minimal movements with the patient's here, the patient's there. You're not flipping them over again and again, so that was super good to see right there. One of the things I would say though is if you go back and look at the video, you're going to see it's a little bit of a hop drop she has. Carolyn has excellent power, but she likes to do this hop drop, and the hop drop is a power robber. It steals away your strength. So let me just set this up really quick. Chelsea, can we get you to lay down?
Yeah.
What else she did really well? We've got this super flexible ex-cheerleader gymnast right here, and so it means you really have to set these people up a little bit differently, but we're going to have you lay on this side facing us. When she sets up here, what she did is to start for the lumbar, which was great, you take and you can see her torso is 90 degrees to the rest of her body right here, right? So she's set up like this. So that was an excellent setup right there. But when you come in and you drop, you're going, so we're going for the sacral adjustment that she did right here, so maybe I don't need to rotate it so much. And it was like this for most of the adjustments. You get down, 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 in. I stop, what happened to all the momentum, right? You probably lost 50% of your power because you're here and then you try and hit at the very end versus if I'll go, are you okay if I go lower?
Yeah.
Yeah, okay. So big breath in from the patient. She breathes out, 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 out. Watch my acceleration, down and hit. And things move when you do that, okay? Because you don't stop the momentum. So that's the biggest thing. But what you did was successful for somebody like her, but there are ways we can generate more power. What else? I love it. The way that she asked for the cervical spine. Are you okay if I just correct as I go? That's exactly what you will do in real practice. This find the end range, come off of it, find the end range, come off of it. That doesn't work in real life. What you did there will work in real life, so it was really good. Anything else that I want to bring up? Hop drop, stop drop. Yeah, you got that, but you'll figure that one out. So this is one for the patients, okay? I always hesitate for this one. All right. As a patient, if you say that felt great, you're selling it a little bit, okay? All right?
Yeah.
Which is fine.
Appreciate it.
Yeah, you can do it. But, yes, don't be overly zealous on that, like, oh, this was the best adjustment I've ever had or something like this, okay? So try and keep it within the realm of reality. Other thing I would suggest, especially if it's not necessarily a joint Mos, but an actual Manip final for joint adjusting, don't adjust each other right before the exam. You look better even though the correlation between cavitation and reduction symptoms is low. You look better on the exam if they're snapping and cracking when you're setting up on them. Okay? All right, what did you think of your thoracic adjustment?
Yeah, I was just telling to Chelsea, I've kind of lost that one recently. It kind of just comes and goes.
Yeah, what are some?
So, yeah, that's one I need to work on.
Okay.
It just the force isn't there, and it could have been the leg, but then I tried bringing the leg up.
Yeah, you can see in your body, you could see that you were out just a little bit on it. But again, there's lots of time. This is, all of us are getting better, even for myself in practice. Some weeks you're like, man, what's going on with these setups? And then things get better as you progress a little bit more through it. Hey, Nora, you coming in? Come on in. Yeah, so that basically concludes our examination process for this time right here. I've also got one of our helpers here who's also an excellent adjuster, probably going to be a massage therapist when she grows up.
Really?
An instructor.
No?
Maybe not. What are you going to be?
Yeah, no.
Doesn't know yet. But anyway, so hopefully this video has been useful for you and you find it beneficial for your exams and practice. And I'd like to give a good thank you to these guys who I'll put links to their practices down below should you want to see them. They are going to be excellent doctors and I would highly recommend seeing them in practice wherever they are in the world, whether it's Nepal or in
Vancouver.
Back in the US?
No.
All right. Anyways, thank you very much and hopefully you guys found this useful.